So let's discuss a very important muscle, the masseter muscle of the jaw, one of the really primary muscles of mastication. First, we're going to go over some anatomy. So let's go over the anatomy of the masseter muscle. We have both sections superficially and deep sections of the masseter. Now, if we look at the origin of the masseter, both the superficial and deep portions attach to the zygomatic arch. If we look at the insertion, they attach to the coronoid process. So up in here, if we actually remove the temporalis here, you can see the coronoid a little bit better here. Love these models. All right, and if we look at the insertion, we'll see that the masseter attaches to the coronoid process and to the superior half of the ramus and the angle of the mandible. So in terms of the actions, the masseter elevates the mandible and clenches the teeth, basically closes the jaw. The masseter muscle is innervated by the mesenteric nerve, which arises from the anterior branch of the mandibular division of the trigeminal nerve. So we get that cranial nerve association here, number 5. Okay, so let's move on to some palpation. So let's go over palpation of the masseter muscle. Mickey, I'm going to get you to start out and just kind of clench your jaw together. There we go. And release. You can really feel that pop out there. Mm-hmm. And again, out. Good. And release. Okay, I'm just going to get in there and kind of cross fiber in there a little bit. Now, it's much easier actually to palpate internally than externally because you've got the parotid gland on the outside here. Okay? Just about called it parotid god. I don't know why. Mm-hmm. Okay, there we go. All right, so open your mouth. Now let me just shift things around here a little bit. And I'll just actually get right on the inside here. Good. Open your mouth there. All right, now I'm just going to go inside. Now you can clench your teeth together. Okay, that really pops up there. Mm-hmm. Turn your head to the side a bit here. Good. So we can get a better camera angle there. Now I'm just going to palpate. Okay, so if I get on the fiber right up there, I can feel it right away. Mm-hmm. You've got a striation going through there. If we consider the orientation of the fibers, it actually pops up pretty easy there. Okay, clench it again and release. So I'm going to start out here and I'm just going to do a little bit of massage in there, kind of rotating around. You okay? Mm-hmm. Down. We can actually follow that all the way down here. There's just a straight line there. Now, we get in and treat the jaw. Don't forget, we're going to be treating both sides. Never just treat one side. Okay, good. So we're just palpating in here. And this is more in terms of just getting in and palpating the area in general. I will go over external treatment in just one sec here. But right now, we're just going over some of the palpation. So let's get on to some treating the external portion of the masseter. I'm going to get over here, and I showed you how we could get on the inside when we're palpating. It's actually partially treatment and palpation when you're getting in there and you're feeling the fibers and doing cross-fiction. In terms of pin and stretch, I'm going to get you to open your mouth here, wide. Good. How's that feeling? Good. Good. Open again. So we consider all the different angles externally. And good. And again. And good. Okay. Now I'm just going to actually go underneath here a little bit because we get some of the fascia that actually connects around here. You okay? Mm-hmm. How's that feeling? Good. Yeah. Okay. I'm going to take my palms here now. Open wide. Good. Wide. And release. You okay? Mm-hmm. Open again. Wide. So you got to give this time to actually release. Don't push too hard. That's not too hard? Oh. Okay. And release. Okay, one more time. Open wide. And release. Okay, I'm going to go down now. So open wide. How's that feeling? Good. And release. That's quite a stretch, isn't it? Yeah. And again, release. Good. And release. One more time. And release. Good. So let's go on to treating some of the internal portions. Okay, so let's go on to treating the internal section. Just put on a new pair of gloves. And something I should mention actually is if you're actually doing this on your patients, make sure your nails are really short. I have taught classes where people have told me, no, I have short nails. And next thing you know, they're working on the area and they're digging their nails right into the skin, the muscle. So, do your patients a favor. Keep your nails really, really short. You probably agree with that? Mm-hmm. Yes. Okay, turn your side here and just clench there for a sec. Okay, and open. Okay, so I'm going to get in here and I'm just going to open. I'm going to get you to even turn your head a bit more to that way so you can actually see. There we go. So we're just going to work our way right around here and really traction and turn. You okay?
Oh, yeah.
But you got to hold it and you got to stretch. You kind of hold it for a sec just so you can get an idea in terms of how malleable the tissue is, and it does start to stretch and loosen up after a while. There, like there's that one trigger point I could feel earlier on here that's starting to let go now.
Mm-hmm. Right there.
Yeah. Perfect. Okay, let's talk about fascia. So something I want you to realize in terms of the fascial connections of the head. We talk about different muscles, but in reality, a lot of them connect together with connective tissue or fascia. And there's high levels of neurological receptors in this fascia. So one area has a direct effect, either mechanical or neurologically, on the other area. For example, if I'm working on the masseter, quite often the masseter is related to neck pain, and it'll cause problems all the way down the cervical area. It could be problems up in the ear in terms of tinnitus. And you'll be working on the area, and you may not see quite a direct connection right away, but there will be one. And you'll work on an area, and all of a sudden the patient will come in and say, I'm not sure why, but my tinnitus is half what it was previously. Or that chronic neck pain that I had since you started working on my jaw is, diminished substantially. Or those headaches that, we've been doing mobilization, manipulation of the neck, I've been getting massage, chiropractic, and it hasn't come around, but ever since you started working on the jaw, all of a sudden, all of my symptoms have diminished substantially. So just remember when you're working on an area, you may be working on a localized area, but it could have a larger systemic effect.